The bitter irony behind Robert F. Kennedy Jr.'s latest MAHA report is impossible to ignore. If you believe that Kennedy's involvement in healthcare reform might bring positive change, his new plan will likely challenge that hope. When former President Donald Trump nominated Robert F. Kennedy Jr., a well-known anti-vaccine advocate, to serve as Secretary of Health and Human Services, the reaction from politicians across the political spectrum and many respected medical professionals was cautiously optimistic. The reasoning is that although Kennedy's controversial stance on vaccines could potentially undermine established immunization standards, his commitment to tackling chronic diseases might bring much-needed reforms to the healthcare system. But here's where it gets controversial. Can the promise of reform truly outweigh the risks posed by his anti-vaccine views? This is the part most people miss when they focus solely on his potential to address chronic illness. The new MAHA report reveals a plan that, rather than improving healthcare, could deepen existing problems and sow confusion among the public about critical health practices. This situation raises important questions about leadership in public health. Should a person with such polarizing views on vaccines be entrusted with a role that influences national health policy? And what does this mean for the future of vaccine confidence and public trust in health institutions? These are not just theoretical concerns. The stakes are high, as vaccine hesitancy has already contributed to outbreaks of preventable diseases. Kennedy's appointment and his new report could either exacerbate or alleviate these issues, depending on how his policies are implemented and received. What do you think? Is it possible for Kennedy's reforms to succeed despite his controversial positions, or will his influence do more harm than good? Share your thoughts and join the conversation below. This debate is far from settled.